Okay, it's already started.
Okay. So we will start with the left atrium, which is going to be the left upper portion of the heart. Nothing's on there. So, upper portion, left atrium. Left auricle is the little ear-looking flap. Right atrium, right upper portion of the heart. The right auricle is this little flap right here. The right ventricle, the lower right portion of the heart. And the left ventricle, left lower portion of the heart. The ascending aorta is coming up right here, goes into the aortic arch, and then it will go down into the descending aorta, completing the little U that it makes. Brachiocephalic trunk, also known as the brachiocephalic artery, is this one right here, coming off the ascending aorta, is the brachiocephalic artery or brachiocephalic trunk. Then you have the pulmonary trunk, comes off right here, which is going to go into the pulmonary valve. You have pulmonary arteries, which are confusing because arteries tend to be red, but these ones are the pulmonary arteries that come off the pulmonary trunk. Then you have the left brachiocephalic vein. So coming off the superior vena cava, left brachiocephalic vein comes left across the heart. The right brachiocephalic vein comes off the superior vena cava, going kind of up and to the right. Again, this is the superior vena cava. Then you have the azygos vein coming off the back of the superior vena cava. The inferior vena cava comes up from the bottom and it goes right into the bottom of the heart. So that's where the inferior vena cava would be coming in. Pulmonary veins are down here. So again, these ones are a little confusing. So the pulmonary veins are red on here, coming out either side. Pulmonary arteries are the blue ones, coming out either side. The ligamentum arteriosum is right here, connects the ascending or the aortic arch, little notch, to the pulmonary arteries. The aortic valve, you can see in here, comes into the left atrium. We have the pulmonary valve, comes into the right atrium. The ligamentum arteriosum, we already did that one. Again, that's right there. The tricuspid valve is going to be on the right. So that breaks up, coming from the right artery into the right ventricle. The bicuspid valve, also known as the mitral valve, is on the left, coming in from the left atrium to the left ventricle. The interventricular septum is what makes that kind of dividing wall in between the two sides of the heart, the right and the left. Tendinous cords are these little cords that attach to the tricuspid and the bicuspid valve. So these little cords, they're tendons, the tendinous cordinae, or tendinous cords, and they attach to the papillary muscles. So the papillary muscles contract, it pulls on the tendinous cords, which opens and shuts the valves. Again, the papillary muscles are going to connect to the bottom of the tendinous cords. See right there. Then we have the trabeculi carnae. These are these long kind of muscles on the side or the walls of the hearts, or the walls of the interventricular septum. The interatrial septum is going to be kind of this wall that separates the right and left atrium. Interatrial septum. So interatrial, interatrial being atriums. Fossa ovalis is this little crater-looking dimple here, which is something that we lost when we were a baby in the womb. And then the pectinate muscles are the little muscles on the walls of the right atrium, and the pectinate muscles.